Night guards, we do a fair number of night guards here in the office. It used to be we would send them off to a lab to get them made, which could take a few weeks to get them back. We've got the equipment in the office now, so we can just make them typically in a week, sometimes a little less. But with a night guard, two reasons we use a night guard, two primary reasons. One would be someone who tends to clench their teeth or grind their teeth, brush their teeth at night. And then some people were using an appliance if they're having jaw pain. Some people call it TMJ. Well, TMJ is a generic term for lots of things with the mouth. But sometimes it could be muscle tenderness up in the temple area, people who wake up in the morning with a headache in their temple area. Those are pretty good signs that they're clenching at night, they're grinding. I grind at night. I didn't have a clue why I was doing it. So I wear a night guard every night. Once I knew I was doing it, I'm doing it primarily so I don't break my big fillings, because I don't like to be on the receiving end more than anyone else. But my night guard also is self-preservation, because I'm getting elbowed by my wife. She says it worsens my snoring. So, and if you ever heard your children grind their teeth some at night, fortunately, they typically don't do a lot of damage, and there's not much we can do on the young kids. Things are changing too much. But you can walk by a child's room and hear them grinding. That's an awful sound. But when you get into the permanent teeth, you can do some significant damage over time on that. And there's no replacing that enamel other than fillings and crowns if it gets severe. So we do a lot of night guards. If a patient has had a lot of porcelain work done, especially anterior veneers and porcelain work, I always recommend a night guard just to protect. Because if a patient does grind, if they're grinding on porcelain, they run a lot bigger risk of breaking something. And then sometimes there's night guards to help protect against grinding, and there are also something called splints, TMJ splints. The goal is similar, but the goal is comfort. Some people come in and they grind, have no pain associated with it. That was my case. Some people have jaw pain, and you're protecting things against the grind, but you're also trying to break up the habit of that grinding. So hopefully you can get the headaches under control, the sore jaws. And for most people, it doesn't take long to get used to wearing it. Initially, you pop it in, you're hitting on plastic instead of tooth to tooth. Some people will tend to drool a little more for a few days until your brain figured out you're not going to swallow this thing and chew it up. It's not a meal, and the saliva slows down. But most people accommodate pretty well. And once they get used to it, they hate to be without it.